Good evening and welcome to KQED Newsroom. I'm Thuy Vu. As the community of Isla Vista mourns the deadly rampage last weekend has reinvigorated calls for legislative action. This morning in Washington, Bay Area Congressman Mike Thompson announced his proposal to target mental health services and reduce gun violence.
People with mental illness are more apt to be the victim of violence than the perpetrator of violence. But nonetheless, there are some things that we can do that will make our communities safer.
Earlier in the week, California Senate Democrats rolled out budget proposals to improve mental health care in the criminal justice system and expand training for law enforcement.
It's a cruel and, of course, a sad coincidence that the significance of one proposal to improve training among frontline law enforcement to recognize the warning signs of mental illness was illustrated by a gun rampage in Santa Barbara County.
And restricting access to guns for people deemed mentally ill is the focus of a new bill in the state assembly. Joining me now for a look at how these proposals would work are April Dembosky, KQED News health reporter, Frank Zimring, UC Berkeley Law School professor, and Josh Richman, Bay Area News Group political reporter. Josh, let's begin with you. California's gun control laws are among the strictest in the nation. Give us an idea of the legal landscape here. What are some of the significant gun laws already in place? And how would this week's new proposals enhance all that?
Yeah, well, it's a very complex landscape because it's the product of decades of legislation and very often bills that were passed in the wake of incidents such as this that sort of galvanized action in Sacramento. But yes, we have overall one of the strictest schemes. We have a 10-day waiting period for gun purchases. We have registration of handguns. We have a requirement that all sales go through licensed dealers and that all sales, even if it's person to person through a licensed dealer, involve a background check, which is more extensive than the national background check. We have an assault weapons ban. We have a ban on the sale of ammunition magazines that hold more than 10 rounds. You can only buy a handgun from a roster of state-approved handguns. So it goes on and on and on. There are a lot of restrictions that are put on.
And yet something like this still happens. So with these new laws, do you think it would change anything?
Well, it's unclear because, I mean, in this situation, you're dealing with a troubled, mentally ill young man, but yet one who had never committed a crime before, one who had never acted violently before, one who did not have a history of commitment for his mental issues or anything like that. And so it's not entirely clear exactly what would have helped in a situation like this. The officers who went to visit him at his mother's request last month did not check the dealer record of sale handgun database, which would have told them that he had bought 3 handguns recently. But it's not standard for them to do so in a situation like that unless there's been a specific threat of violence. So, you know, I think what you're seeing now is more of a concentration on the mental health issues. Darrell Steinberg has long been a champion of mental health issues, of better spending, of better planning for that. And I think you would have seen these bills coming forth anyway. It just so happens that it happened to follow this horrible thing that happened.
And then we have, of course, Berkeley Assemblywoman Nancy Skinner, who is proposing the so-called gun violence restraining order, April. And this targets specifically very much the mental health issue. Talk about what it will do, and do you think it will make a difference?
Well, I think there's a lot of questions around whether Skinner's bill really can make a difference. I think what Skinner wants to do is basically we have current laws now where if someone with a mental illness says to their therapist that they are thinking about causing harm to themselves or to another person, that there are some requirements around when a therapist will have to report that either to mental health officials in the county or law enforcement. And what Skinner wants to do is expand that power to family members to alert authorities around whether or not for someone who they think might be prone to cause harm.
And I would imagine there are quite a few civil liberties concerns with that.
Well, first of all, there are a lot of law enforcement efficiency concerns, and there are a lot of civil liberties concerns. The problem that we see portrayed very accurately in the Santa Barbara setting is that the police and the parents are strangers. That's a voice over the phone. So one possibility is that the young man has serious emotional difficulties. Another possibility is that the mother on the phone has serious emotional difficulties. Put yourself in the position of the police officer. How do you arbitrate those? How much do you invest in the investigation of worried parents? At least when you're dealing with professional therapists, you have some quality control at the outside. But the other problem that you have at the outside there is that the more you make therapeutic professionals, agencies of law enforcement or investigation or labeling of the people they treat, the more often the truly mentally ill are going to try and stay the hell away from them. So that you have a real counter-deterrence.
And that's a really interesting point about Darrell Steinberg. We heard a little bit from him at the opening. Part of his proposal this week is to expand spending on training of law enforcement officers. And that's partly in recognition of the fact that they are the first responders, and increasingly people with mental illness are in prisons and jail and in contact with the criminal justice system. But it does raise a really interesting question about, if a police officer comes to your door, are you going to open up about concerns you have about your mental health? Probably not. I mean, as a society, we kind of learn to fear law enforcement. And so I think, some of the people who are opposed to some of this spending are arguing, let's reinvest that money so, a social worker shows up at your door.
Well, it may be worse than that, by the way. There may be millions of people who are willing to tell the police all their troubles, but I don't think those are the most dangerous people in society. When you're planning to become a mass murderer, you're not necessarily going to put your arm around a policeman and make a full confession.
It's hard for licensed therapists to recognize that sometimes, especially in the 10 or 15 minute window that an officer at the door might have, or, in this case, what they had with this young man in Santa Barbara. It's hard to imagine the degree of training you could give police and deputies that would enable them to really see this with any great consistency.
And we should also point out that cases like these are the ones that grab national headlines, but the reality is that a very small percentage of violent acts are committed by the mentally ill, only 4% of the violent acts in this country. So that you have that whole stigma issue as well. Do we want to stigmatize the mentally ill? But I want to get back to the civil liberties issue with you, Frank, and that is, what are the civil liberties concerns here with something like the restraining order proposal, and how do you strike that balance between public safety and individual liberties?
Okay, well, it turns out to be a more peculiar problem in the United States. And the reason for that is that firearms ownership is part of an ordinary citizen's civil liberty here. With regard to handguns, the issue isn't that in the United Kingdom. It isn't that in the city of New York under the Sullivan Act, because ordinary citizens are not entitled to have handguns. But as soon as what we're saying is that while we're going to regulate access to some extent and require waiting periods, everybody can have all the guns he or she wants, what you have done is define into citizenship what is a potentially dangerous aspect of owning and using firearms, and then whomever it is that you're trying to separate from access to a gun can feel aggrieved and stigmatized in the doing of it.
But let me play devil's advocate for a minute. Gun rights advocates will say it's not the guns that are the issue, it's the people who have the guns.
Well, it's both. It's very, very difficult to shoot somebody without a gun, and it's very, very difficult to have a murder without an offender. It's the combination, however, of the wrong people and the dangerous weapons, and that's the same combination that everybody sees in developed countries all over the world. The public choice that we've made and the we in this case is even California, is not to try and make restrictive access to most firearms, including handguns. And one price of that is that our capacities to, in that case, restrict ownership and use possibilities to anyone is greatly reduced. And the stigma that goes with being not eligible to own a gun is much greater in the United States.
And let's remember that in this case, 3 people died as a result of a knife being used as the weapon, not a gun. And I take your point about stigma very seriously, because incidents like this, I'm not sure any legislation could necessarily prevent, freak incidents like this. But a lot of my concern about a lot of the proposals that are being made is that they inadvertently stigmatize people with mental illness. And I think one of the concerns we need to look at as a society is how do we destigmatize mental illness so that people feel comfortable getting help? Because one of the themes from this story is that this young man had access to mental health services, but he didn't want to take medication. He didn't want to pursue them.
And it's definitely a debate that is very much growing nationally now. Much sadness and mourning at UC Santa Barbara and the surrounding community, obviously. But I want to thank you all for being here. Josh Richman, April Dembosky, and Frank Zimring.